Hi, this is Andy Orem from O'Reilly Media. I'm talking today to Lauren Thompson, who works at the Office of the National Coordinator, and she is the director of the Federal Health Architecture, which links together a lot of institutions in the federal government. And I figured it would be worth having a conversation today because if the private sector is supposed to communicate, if the healthcare institutions are supposed to be exchanging data, then the federal government should be getting its own act together. And I think that, Lauren, you're doing that. Is that right?
Certainly hope we are.
So tell us a bit about who is in the federal health architecture, or a couple of the different institutions.
Well, let me first give you a little bit of background. The Federal Health Architecture Program, which we refer to as FHA, is actually an e-government initiative that was started in 2004 with the objective of bringing together a collaboration of government entities in the health space to create interoperability across those agencies. It was one of a number of eGov initiatives. So we've been working since then to try to facilitate interoperability across federal agencies, which include the Department of Defense, Department of Veterans Affairs, Centers for Disease Control and Prevention, Centers for Medicare and Medicaid Services, Social Security Administration, and a number of other government health care organizations have also participated over the years as well. And not only are we trying to facilitate interoperability across government agencies, but we're also trying to facilitate the interoperability of those agencies in their pursuit of their mission with their partners in the private sector. So that's a big part of the program as well.
So when a hospital is expected to submit public health information, for instance, you're hoping to provide a better system for them to do that.
That's exactly right. So rather than having to pick up the phone or send a fax, they're able to electronically transmit the data to the government.
And last week there was the Health Data Initiative in Washington, D.C. That was widely reported, and they talked a lot about the kinds of data that they're collecting and now sharing, which you're helping to make possible.
That was a big event, and we work with the HHS CIO's office in facilitating the collection and exchange of data through the Nationwide Health Information Network Exchange, as well as other venues.
I'm just a little curious to go back to 2004. What was available then? What were you trying to use? What kind of technologies and systems were you using?
Well, at that time, the focus was very much on creating the overarching enterprise architecture for health. So the focus was really on creating a health enterprise architecture that would span that would span the health businesses of the federal agencies. And at that time, many of the standards development and standards harmonization activities that are now being pursued through the Standards and Interoperability Framework under the guidance of the Health Information Technology Standards Committee were also being worked on through the Federal Health Architecture. So over time, the program has evolved while still maintaining its focus, and really has extended to include many of the other activities that are now going on within the Office of the National Coordinator for Health Information Technology, as well as other agencies.
So did you feel that you are starting with a blank canvas, or were there some things you could work with?
There was absolutely a strong foundation. Clearly, the health industry has changed significantly since the initiation of the program, and we've made huge strides in automating health information, getting electronic health records out into provider organizations, and creating some of the data exchange that is really crucial. So there was a very strong foundation that has been laid over the years, and we're very well positioned right now to extend that interoperability. And that's really where our focus is right now, in creating that interoperability architecture.
And so we have what is called the Nationwide Health Information Network, and I think our listeners might know about it, but you could describe it a bit and tell us what the current state is.
Certainly. I want to make a distinction between the Nationwide Health Information Network, which we characterize as a set of standard services and policies, and the Nationwide Health Information Network Exchange, which we refer to as the Exchange. And the Exchange is the collaboration of organizations that are utilizing the standard services and policies of the Nationwide Health Information Network to exchange data with one another. We have a number of government agencies participating in that: Department of Defense, Department of Veterans Affairs, Social Security Administration, CMS, exchanging data with their private partners in the private sector. A number of healthcare organizations are participating, exchanging data with the VA through the Veterans Lifetime Electronic Record Program. Entities are exchanging data with Social Security Administration for disability determination and benefit determination. So we have a large network of entities exchanging data in a secure manner through the protocols that have been put into place with the exchange, all of whom have committed to exchanging data in a secure manner, and who have done so by signing a data use reciprocal agreement, which ensures that the data that is being exchanged will be protected. So that's a very important component of that exchange.
So if I walk into my doctor's office, which I will do for a routine exam later this week, how likely is it that they are connected up using the network? And how would this be different between, say, a small doctor and a major hospital?
Right now, we have a number of larger healthcare systems, and many of their doctors participating. If they have gone through the process of what we call onboarding onto the exchange, there's an application process that an organization needs to go to that is designed to ensure that they have the technological capability of exchanging data, and that they have signed the DRSA, the data use agreement that ensures that the data that will be exchanged will be protected. If they have gone through that process, then and they have been accepted, then they are able to exchange with anyone who has also gone through that same process.
I also understand the Department of Defense and the Veterans Affairs have been trying to harmonize so that it's easy to make the transition between them. How is that going?
Well, there are a number of initiatives that the DoD and the VA have underway. One is called the Veterans Lifetime Electronic Record, the VELR initiative, and that is active now, operational. That's the mechanism by which the DoD and the VA exchange data with one another as well as with their private sector providers. They also have underway an initiative called the Integrated Electronic Health Record, IEHR initiative, which is their joint effort to create, through adopting existing technology and developing where necessary, a common electronic health record that would be shared across the Department of Defense and the Department of Veterans Affairs. The idea there is, rather than an active duty service member or veteran having to enter into a different system in each department, that they are sharing a common electronic health record, which would significantly streamline the process for the veteran.
Blue Button, of course, has been getting a lot of attention, but that's just a data exchange format. That's what the patient gets when he downloads the data, but then there are records on the other side that could be in a very different format.
Yes, the Blue Button provides the individual the ability to download their individual patient data. Of course, in the provider organization, there is an electronic health record that houses that data, and the organizations are able to exchange data between the electronic health records in the VA and in the DoD and in private organizations who may also be servicing that individual.
So what is your department working on right now to push forward the federal health architecture?
Well, we have a couple of things underway. We are working with the exchange to expand the network, and the exchange is going through a transition. over the next 6 months, from a government-funded initiative to a public-private partnership. There's a new entity being created that will serve as the focal point for the coordination and onboarding of new entities into the exchange. So we're working very closely with the Exchange Coordinating Committee in that process. We are also, I'm sure you have heard reference to Connect. Connect is an open source software gateway that has been developed through the Federal Health Architecture Program. And we are transitioning the Connect software, which is an open source product, to the open source community over the next 6 to 9 months. We are continuing to develop some new capabilities into the software that will be put out into the open community. And what we're really hoping to do over the next 6 to 9 months is make the capability available to the broader healthcare industry for use in their exchanges.
And Connect will be particularly useful, I understand, for the larger institutions. It does require a fair amount of configuration and programming.
But it's a service-oriented architecture, so it does require some certain amount of technological knowledge and expertise and capability within the organization. All of the government agencies, the VA, the DoD, SSA, and CMS, who are participating in the exchange, use the Connect product, as do a number of the private organizations participating in the exchange. And we are hoping as we move forward that additional organizations will choose to use Connect and participate in the exchange and exchange data with other entities in the network.
And are you involved in the Direct project as well, or Direct Trust?
Not significantly. What we are hoping to do, Direct is a separate but related transport standard. It is our plan over the next 6 to 9 months, as we continue to develop new capabilities in Connect, that we will be building into the Connect code the Direct specifications. So an organization that implements the Connect software will also have the capability of utilizing the Direct transport as well.
So a doctor who has nothing but email will be able to send data to an organization that has the Connect protocol set up.
That's the ideal, and that's where we're trying to get to.
All right. And I suppose this work on Connect is an example of how something, you do say a lot of institutions are connecting to the government at this point, but this project can also help institutions, private ones, to connect to each other.
Absolutely. Once an organization has onboarded onto the exchange, they have the ability to exchange with any other organization that has also onboarded. So private provider organizations can exchange with one another as well as with the government organizations participating.
And what sort of advantages do you see to the healthcare field? We've talked a lot about, in the healthcare field, about patients having access to data and so forth.
Mm-hmm.
So where are you headed in changing the healthcare field?
I think it's really very transformational as the health information exchanges of all types increase in scope. There's really the ability to share data and the impact that can have on patient care and the quality of patient care is very, very significant. We're already seeing that today in the experiences of the exchange. And so not only is there does the patient have access to their health information, all of the providers that service that patient have access to the same information. So there's the ability to avoid some of the medical errors that have occurred in the past, because the providers have the full clinical record available to them. We've also seen some cost savings on the part of some of the provider organizations who are participating in the exchange, because they're able to determine that a patient is eligible for certain benefits that they did not know about before. So they're seeing some significant cost savings as well.
Great. And are the data exchanges being done through existing organizations, health information exchanges, or is there some new sort of parallel system being set up?
It's really, there are many initiatives ongoing today in addition to the Nationwide Health Information Network Exchange. As you know, there are a number of health information exchanges that are being established across the country, and it's really the intention through the regulatory process of establishing standards for data exchange that we hope to be able to extend the exchange of data from the Nationwide Health Information Network Exchange into many other health information exchanges as well.
Well, is there anything else you'd like to tell us before we end the call?
Only that I think this is a really exciting time in the healthcare industry. I think it's, as I said, I think we're at a very transformational point with the proliferation of health information exchanges and the security protocols that are being put into place to assure security and privacy of the data. Really very excited about the success that we've seen with the Nationwide Health Information Network Exchange and all of the number of other exchanges that are ongoing. And I think over the next few years, we'll see an increased movement towards ubiquitous exchange. So, and that's very exciting.
And that Health Data Initiative in Washington certainly show that the activity is extremely, there's a lot going on certainly right now.
Absolutely. We have incredible support across the administration and the White House, and it's really very exciting.
Okay. Thank you, Lauren.
Thank you.